Today I'll be doing a Foley catheter. The first thing I will do is review my physician's orders. I will then enter my patient's room, perform hand hygiene, introduce myself, identify my patient 2 times, explain the procedure I'm doing to my patient, which will be a Foley catheter. After that, I will uncover my patient and give the patient provide for privacy. I'll assess for pericare if needed. Patient does not need pericare. All right, I will then uncover my patient, perform hand hygiene, pull out my catheter kit. I will use this bag as a disposable bag. I will then take my sterile gloves. I'm having to use blue gloves because the sterile gloves will not fit my hands. Pull them out. I will then take my sterile field, put the shiny side down. I want to make sure not to touch anything with my sterile field to contaminate it. I will then take my Foley kit and set it down. The first thing I will want to do is check the balloon on my catheter. I want to instill 5 milliliters to check that it's functioning. And I will leave it hooked up and leave it in the box. I will then put some lubricant in my field, in my box, discard my trash, and then I can remove the plastic from my catheter, making sure that I do not touch the catheter to any unsterile surface. And I will discard into my bag. I will then take my solution, pour it into my tray so I can clean the area. I will then pull it, I will spread it, take a cotton swab, and I'll clean away from me. Go around, take a cotton swab, dip into my solution, clean closest to me, stay off my sterile field. I will then take another cotton swab, dip in solution, and clean the center, come around, and then I can discard my forceps. I will then want to make sure to lubricate the catheter and insert it 2 to 3 inches. And then instill 5 milliliters. Okay, then I will want to hold my catheter remove my syringe and discard it. I will then want to remove my sterile gloves discard them into my bag. I want to check to make sure that there is some slack, but the catheter is intact. I will then get some tape to secure my catheter to my patient. I will then want to take my catheter and drape it to the side of the bed. I will then dispose of my sterile field into the appropriate container. I will want to put gloves on. And dispose of my trash bag into the correct field. Dispose of my trash bag into the correct place. I will then uncover my patient's legs. I will make sure the patient is clean and comfortable. I will cover my patient back up. And then I will document the procedure. I will say what gauge or what size catheter I used. I will document appropriately, perform hand hygiene, and make sure my patient is comfortable and call bells and within reach.